council, we had several discussions over the past 6 months or so regarding the need to make modifications to the Kahnawake Emergency Preparedness Law, because the way it's currently structured is where it's basically an on-off switch. In order to have directives or have measures in place that are enforceable under Kahnawake law, you have to be under a state of emergency, and that's the way we exist today. But then we were looking forward down the road to saying, when we evolve out of a state of emergency, so we can end the state of emergency, there still had to be a level of directives that are enforceable, measures that are enforceable. We developed an area what we call the recovery phase of emergency, which we expanded the law to include mandates for myself as a commissioner and or the task force to be able to maintain certain measures, to put into place a plan for recovery and a staged approach. But the general goal is to move away from the state of emergency, move towards normalcy, and then take those steps in a structured manner to bring us back to whatever our new normal is going to look like in the coming weeks and months. So it's a staged approach, but it still has that the mandate and the authority to do what you need to do to bring us to that point. The current state of emergency ends April 21st, as the last renewal was done. Over the next week or so, I'll be assessing with the task force on the overall state of affairs in terms of Kahnawake and all what's happening around us, and then I'll be making a formal recommendations to council in the next several days on whether or not we move into recovery phase or if we need to maintain the state of emergency at this point in time. So that's to be determined, which brings me to the next point, because one of the main concerns right now within Kahnawake, as we're watching, but in Quebec, in Ontario, and throughout Canada, is the dramatic increase in the variants. The one that they generally call the UK variant is becoming more and more dominant, in Ontario and many parts of Quebec. It's more transmissible, spreads much easier. And now they're seeing that more and more younger people are getting very ill and end up in ICU from these variants. So that's concerning. That's why you see Ontario taking very drastic steps in the past couple of days, and they're going to be announcing very soon probably a complete lockdown of the province for a period of time. Early as yesterday, Premier Legault from Quebec had made additional restrictions in the greater Montreal area, rolling back some of the previous measures. These again be done as a way to stop the spread of the variants, because again they're seeing the numbers increase. If you roll back the clock just a few weeks ago, you're averaging 500-600 cases per day. No, that's double. No, the healthcare systems can't afford to see that double again, because they're already at their breaking point in terms of ICU beds and hospital beds available for individuals with COVID. After 1 year, the staff, the nurses and doctors and everybody involved are also extremely tired as well. So it's very, very important that they take proactive steps. And as a community, we have to keep an eye on that as well. And even though we're doing very well as a community, against 0 active cases as we speak today, we have 70% plus of a community vaccinated with their first dose. We don't live in a bubble. We have to be aware of what's happening around us, and we can't in no way contribute to the problem that's happening outside of the boundaries of Kahnawake, or contribute to the further degrading of the healthcare system, because our people need that system just as much, whether it be COVID, but people are also suffering because people have various treatments, heart treatments, cancer treatments, and other type of treatments that they are supposed to be getting or should be hospitalized, who are not getting them or not getting them in a timely manner because the hospitals are backed up with COVID patients. So we have to keep our eye on that as well, keep our community safe, not only from COVID, but now we also have to look at non-COVID medical illness. And of course, we always been looking at more hard about the mental health of our community as well.